This is our last video blog, and it is on speaking to our patients or clients about their sexual identity and/or preference. I think this is a very important subject for us to talk about, and I think it's one that the healthcare field kind of shuns to the side, and I think that is not right. I think we need to meet it head on. I think there are those in the profession, in the healthcare field, who still have these biases and prejudices against someone with a different sexual preference or identity than heterosexual, and to them that is not right. And I think that is anyone who's entering the healthcare field, I think if you're going to enter that field and you have a prejudice or bias that is significant enough that it will hinder your ability to rehabilitate or treat someone, then you need to choose a different profession, or at the very least you need to leave that at the door when you go to work. I think this week's material is very indicative and a great example of how complex and diverse treating someone is. It isn't just giving someone a drug or giving someone a list of exercises to do when they go home. I think it's so much more than that, and I think this week is a great example. In the video for LGBT, when the patients are talking about just how important it is for their provider to know who they are. They say, how can you possibly treat me if you don't even know who I am, if you don't know my sexual identity? So it certainly seems to them that it's not something that they want to hide. It's something that they want their provider to know. And therefore, I think our duty as physical therapists and then anyone entering the field is to not just leave it there. It's to ask, and it's not to assume that everyone is going to be heterosexual. I think it's an important question for us to ask. And I think it's a great example that it's this trust relationship that we're building with the client, and that is so important, and it goes beyond just giving the exercises. Like, you could have two scenarios for a physical therapist. Say you have a female come in, she's lesbian, say she has a rotator cuff tear, and you have one physical therapist who never asked her sexual identity, never brought it up. Maybe something came up a little bit. Maybe he saw her partner come in and he never mentioned it to her or asked. Then maybe this lady would go home with a set of exercises to do, and she would say, why should I even do this? He doesn't care about me. He doesn't even know who I am. He doesn't even know my sexual preference. He never even asked. And I think that is the great impact on patient adherence to a program or rehabilitation program or drug regimen that you're giving them. So much of that is going to be on the trust that you have with their caretaker. Whereas this lady, you could have someone that was very warm and welcoming to it. They asked, they wanted to know, and they let them know that, hey, it's okay. We're going to treat you just like we treat everyone else. And then she may go home with her list of exercises and say, hey, I need to get this done. Joe really cares about me. He knows who I am. He believes in me. I need to get this done for him. If not just for myself, I need to do it for him. He really cares about me. So I think this week's material is just so indicative of how important and complex it is. It's not just about giving a drug or giving a list of exercises. And beyond that, there's, for other healthcare professions, I think it's very important for them to ask and to know, because it might have more direct implications for them. It states in the video that people who are LGBT, they're a higher risk for STDs or certain other ailments. So that's definitely something that they need to ask, because it's very important for them to know. And for physical therapists, even, it's important for us to ask, because then that may open the door to other things that this patient might not want to talk about. So, how are they going to talk about, if they don't want to talk about their sexual preference, they might certainly not want to talk about their alcohol abuse or their drug abuse. So this is the way to build that trust and open that door, so that we can really get to know that individual in certain topics or subjects that they might not wanted to have talked about until you build that relationship and that trust. So I think that about sums up our role for speaking or talking to our patients or clients who might have a different sexual preference or identity. Thank you.